That's number one. You kind of reset.
Painful, tender to the touch. May also
Same shoulder length, and the other. Hey everybody, welcome back to another episode of the Real Health Podcast with Brandy and Amir. You'll notice Brandy is not here today. I am Dr. Amir Rashidian, a chiropractor, and with me today is Dr. Michael Lacey. Welcome.
Whoa.
So Dr. Michael has been a chiropractor for 13, 14 years now. and
Yep.
We've been working together for 3 years,
Yeah, it's been great.
every day. He's an amazing doctor, incredible knowledge. He's got nice insights. You're wondering, why isn't Brandy here? We did not fire her. She has the power to fire us.
Yeah.
We cannot fire her, so rest assured, she's good. But she's doing something with the school. The kids' school needed help. She is the PTA president over there.
She's always so busy.
She's always busy.
Yeah.
President of everything. I don't
Yeah.
know how she does it. So Dr. Michael is sitting in, and we've already had a great conversation. So we can't wait to share it with you. So in case this is the first time you're watching, the Real Health Podcast is where we take the latest news about healthcare and health information, whatever's in mainstream media. And what we do is we dig deep into it, we study it, we summarize it for you, and we tell you what it means from a health and wellness standpoint. The purpose for the podcast is so that we can help you feel better, get stronger, live longer, and feel younger. So you feeling healthy today?
I'm feeling healthy.
Good.
Feeling good.
You know, the most special thing about Dr. Michael is that children love him. My 3 sons love him. They anytime they're getting together, they go, "Can Dr. Michael come?" Anytime they have a birthday party,
Yeah.
like the first person they want to invite
Yes.
is Dr. Michael. So
Sometimes.
I think, if kids love you, that means you're a great person.
Yeah. Well, thank you.
So let's jump right in. First article is from Fox News.
Yeah.
Title of it is "Minnesota Woman Survives After 25 Minutes Without Pulse. Warns Others About Sudden Cardiac Arrest." That sudden cardiac arrest has been a big thing recently.
Yeah.
A lot of
Ooh, a
people.
lot.
The numbers are
All of
through
a
the
sudden,
roof.
yes.
It's too much. So
Yeah.
and I know everybody has a theory about why that's happening and so on, and they're all theories, but you can't argue with numbers.
No.
So when you introduce something different into the population, and then there's a new outcome that comes, you can say there may be a correlation between that. Maybe not causality, but what else would be causing it? So anyways,
Yeah.
you can use your own
Right.
judgment on that one. But here's what the article says. Minnesota woman who went 25 minutes without a pulse is sharing her survival story to raise awareness of sudden cardiac arrest, abbreviated SCA. Cheryl Jordan Winston was 48 years old in 2020 when she collapsed in her bedroom after experiencing SCA. Her husband performed CPR until the paramedics arrived and shocked her with an AED, which is automated external defibrillator. Winston was taken to the hospital and put in a medically induced coma where she remained for 2 weeks. This sounds a lot like that football player. What was his name? Hamlin? Damar.
Hamlin, yes.
Damar
Damar
Hamlin.
Yep.
Yeah, I mean that happened on national TV.
Yeah, on
Very
TV.
scary.
Yeah.
They worked on him for a good
For a
20
while.
minutes too, I think.
Yeah. Yeah.
So in quotations, it says, "Despite being without a pulse for 25 minutes, I have no long-term side effects and have been able to return to normal life," she told Fox News Digital in an interview. Prior to experiencing her SCA, Winston had no symptoms at all, no fatigue or chest pain. She would later learn that it's common for there to be an absence of symptoms prior to that type of cardiac event. She said, "I've also had no prior history of heart issues. While there's some family history of high blood pressure, there was nothing unusual in my family that would be linked to sudden cardiac arrest." And this is where the mystery comes in, is sudden cardiac arrest seems to be an electrical stoppage of heart function.
Right.
The
Yes.
heart suddenly stops beating. It's as a part of a worldwide clinical study. Winston received an implanted cardioverter defibrillator, abbreviated ICD, the Medtronic Aurora EV ICD to prevent future life-threatening episodes. It monitors my heart, and if it sees an arrhythmia, it will provide therapy to return my heart rhythm to normal before a cardiac arrest, she said. I feel it's added protection for me since they never found a cause for my cardiac arrest. I don't think they found the cause of anybody's cardiac arrest.
I mean, and there needs to be, more questions asked. I know I've heard, like you said, a lot of theories, but
Exactly.
yeah.
Within 2 weeks, Winston was able to return to work and normal activities. I feel great, she told Fox News Digital. I make it a point to continue exercising regularly, focus on eating a healthy diet, just as I did before experiencing sudden cardiac arrest. Dr. Alan Cheng, Chief Medical Officer of Medtronic's Cardiac Rhythm Management Division in Minneapolis, warned that cardiac arrest often results from a dangerously fast heart rhythm and is deadly if not treated immediately, which is why past 4 years athletes have been collapsing, like Damar Hamlin,
Right.
like maybe Bronny James.
Right,
Those were the two high-profile names, but there's been so many. A lot of football players, soccer players. I call it football because where I'm from, that's actual football. But
Right.
although I love football, American
We,
football.
we say it wrong over here.
But yeah, a lot of athletes.
Yeah.
The numbers went from something like double digits to quadruple digits.
Yeah.
Per
Ridiculous.
year,
It's ridiculous.
which is tremendous. So this is an implant they put in there. They monitor the heart's rhythm 24/7, deliver either a high energy shock or low energy, nearly undetectable, pacing pulses to restore the heart to a normal rhythm, which, technology is great and I love it. It says they work extremely well in saving lives, but there are potential complications associated with those leads in the heart. With the new Aurora EV ICD, that lead is placed outside the heart under the sternum breastbone. So they used to have longer. I think the old ones had longer wires.
Yeah, we can see them on X-ray.
That's right. Yeah, whenever we take those X-rays, we see them. But yeah. So, anyways, the scary part is they're basically saying when your heart rhythm goes up, like high-level athletes when they run or they're lifting weights or something, their heart rate starts to go up. They're at higher risk of that. It says, unfortunately, it can be an unheralded event that comes on spontaneously without warning. Up to 50% of those affected by SCA might have symptoms weeks prior to an SCA event or up to just minutes preceding an SCA. These symptoms may manifest as chest pain, shortness of breath, racing or skipping heart, lightheadedness, or dizziness. And I know a lot of our audience is probably going to be scared hearing this. They go, I just had some dizziness or lightheadedness. Am I about to have sudden cardiac arrest?
Right.
And it's very scary. It's a good idea to obviously just get checked, but it seems like there's just make sure you're healthy. Just take good care of your body as a whole. And we have a patient who has chest pain every time he rides his bike. I'm not gonna obviously name him, but when his hands are on the handlebar and he starts riding, a certain number of minutes into his ride, he gets pain in his chest. They've done all kinds of tests on him.
Yeah.
Okay. He doesn't get shortness of breath. He doesn't get a fast rhythm. His blood pressure doesn't go crazy. I mean, he's exercising, so his blood pressure's higher. But when he's riding, when he's at rest, it's normal. Everything's normal. So they're going to do an angiogram next to find out what's going on.
Yeah, I'm interested in that.
Yet from a chiropractic standpoint, clearly, I think it's probably musculoskeletal. With your hands on a handlebar, vibrations of the bike and whatever, you could be experiencing trigger points in the pectoralis muscles. You can actually have anterior rib subluxations. So I actually adjusted his ribs anteriorly, the front of the ribs, last time he was in. But he's not allowed to ride his bike until after the angiogram, so we won't know if it worked.
But it's funny because we didn't talk about that prior, but I was thinking the same thing. That's probably musculoskeletal.
Exactly. He
So
just doesn't fit the profile.
he doesn't. He doesn't.
So SCA can stem from a multitude of conditions, including advanced lung disease, significant sleep disorders, extraordinarily stressful or anxiety-provoking situation, a severe injury, substance abuse, or unintentional overdose of prescribed medications. So listen, this is what we said earlier today inadvertently or maybe subliminally, is that medication can cause this. And the article is saying that. Things we put into our bodies do have effects on the body.
Yep.
And the term side effect is a marketing term, guys. It's not side effect, it's effect. They have effects.
Yes.
And so, but when we call it a side effect, it seems like it's not as bad or not as severe. It's every drug has desirable effects and undesirable effects. And we just need to be very careful.
Yes, and there's a balance, in the body, chemical
Absolutely.
balance. So you throw something in there, it's good. You're throwing off chemistry.
You cannot predict.
You cannot predict
how the body responds to anything you put in your body, let alone when you put two different things.
Yes. Yeah.
And fact of the matter is, this was published somewhere. So don't quote me on this. I might have heard it on a podcast. I don't remember where it was, but they literally said, and it was a medical doctor speaking, said in medical school we don't train on over-the-counter medication, which means we really don't know what over-the-counter drugs do to the body. We just assume they're perfectly safe. And maybe they are perfectly safe until you add something else to it, or until you mix two of them together.
Right.
Where was I? Underlying heart condition, whether it's previously known or unknown. SCA is the initial manifestation of significant coronary heart disease in 15% of those who suffer from this event. Risk of SCA also rises with age and other risk factors such as diabetes, uncontrolled cholesterol, cigarette smoking, heavy alcohol consumption, or a strong family history. Now, one of the things we were discussing before we started recording today was that those are risk factors for myocardial infarct, not SCA.
Yeah, right.
So they're two separate things. Myocardial infarct is when there isn't oxygenated blood reaching heart tissue and that part of the heart dies.
Right.
That's a heart attack. It's not cardiac arrest. Cardiac arrest is electrical. And I believe this article is very misleading, that whether intentionally or unintentionally, I don't know. You can make up your own mind about Fox News and what they're trying to say or not say. But these are all risk factors for myocardial infarct. We truly don't know what causes the sudden cardiac arrest. It says men are up to 3 times more likely to suffer SCA than women. Reasons for this are not well understood, but some researchers have considered that the estrogen hormone that is produced by a woman's body might have beneficial effects on blood cholesterol levels, as well as protective effects on blood vessels. So again, blood vessels and cholesterol will cause myocardial infarct, not sudden cardiac arrest.
Right.
These people who have sudden cardiac arrest, their arteries are clear.
Yeah. I mean, and it's myocardial infarct is more plumbing, right? So plumbing issue. And the thinking is that I think with the infarct, it could damage the heart muscles that can lead to cardiac arrest. I think that really needs to be explained a little bit better. It's really confusing.
Yeah.
It can be really confusing.
Well, that's why we do the podcast, right?
That's why we do the podcast, right?
I was talking to my older son's drum teacher. After drum lessons, he said, I think I set a world record in the gym. He's 70. He said he's 71, and he did a deadlift of 435 pounds. And someone else in the gym looked it up, said, "Oh, for 70 years old and over, this is a world record."
Wow.
So he's obviously very strong.
Yeah.
And I said, so you're pretty healthy. He goes, well, I had a heart attack in October.
Wow.
I said, wow. So what'd they do for you? Did they put a stent? Did they do open heart surgery? What'd they do? He said, no, I didn't need any of that. He said, my arteries are all clear. Everything's perfect. Everything's fine. I go, so that must have been a sudden cardiac arrest.
Right.
Not a heart attack.
Right.
Not a myocardial infarct.
Right.
So anyways, thankfully he's healthy
Yeah.
and his heart's functioning again. But I had to warn him that if you exert yourself to the point where your heart starts racing and you're prone to, for whatever reason it might be, you're prone to sudden cardiac arrest, you got to be super careful.
Right.
and they talked about how immediate chest compressions are important, and doing a shock from an AED is important. For patients who have one or more coronary artery blockages, treatment may also include angioplasty, placing of stents, or a surgical coronary artery bypass. Again, that's not for SCA, that's for myocardial infarct.
From the plumbing. Right.
Exactly. And then the last thing it talks about is, it says it is possible that a heart healthy lifestyle leading to controlled blood pressure, blood sugar, and cholesterol levels through a thoughtful and discretionary diet, increasing regular physical activity, intentional weight loss, and stopping cigarette smoking might reduce SCA events. And you said something. Go ahead and say it. You said it before the recording. You said that you looked it up somewhere, and the reason this can reduce SCA is an indirect result.
Yes. Like through the Mayo Clinic, they said, coronary artery disease can lead to sudden cardiac arrest, but it's secondary,
Right.
So, and that needs to be spliced out.
Yeah,
That definitely
exactly.
needs to be spliced out.
So
Because sudden cardiac arrest is sudden,
It's
right?
sudden.
So you're gonna have a heart attack. You're gonna have symptoms first,
Yeah.
So, but sudden cardiac arrest is,
Exactly. It's not because of clogged arteries. It's not
Yeah.
because of cholesterol.
Right.
It's not because you've been smoking or any of that stuff. All of those will cause heart attacks, but SCA is different. And so I am not happy with that. This happens a lot, Doc.
Yeah.
I read these articles. I go, I don't like this article.
No.
That's another one that I don't like. But you know what? What's interesting, the reason we brought it up is so we could tell you the difference between those two types of heart incidents, but also that a woman was without a pulse for 25 minutes
Yeah.
and has no significant
after
problems
that.
afterwards.
Yeah.
Pretty good.
That's
The
pretty
human body is incredible.
It is.
That's
Oh, yeah.
innate wisdom.
Innate wisdom. Absolutely.
The next article is from New York Times. Surgeons transplant pig kidney into a patient, a medical milestone. Now, if you all remember, if you were with us a while back, we talked about how a pig kidney was put in a brain dead individual. So there was a gentleman who was brain dead. Basically, his brain had no activity, but his body was kept alive with machines. And they transplanted a pig kidney into his body as an experiment to see if it could produce urine, and his body did produce urine. And a month later, from when we reported on it back then, a month later, he was still alive. Brain dead, but body was still alive, and the kidney was supporting life, which is pretty neat. So now they've actually done it in a non-brain dead person, a conscious person. And it says the man continues to improve, doctors said. Organs from genetically engineered pigs one day may make dialysis obsolete, which would be amazing.
Mm-hmm.
Surgeons in Boston have transplanted a kidney from a genetically engineered pig into an ailing 62-year-old man, the first procedure of its kind. If successful, the breakthrough offers hope to hundreds of thousands of Americans whose kidneys have failed. Now, there's a lot of money in dialysis, so those people are going to be out of business.
Yes.
I always want to talk about money because that's where things go these days. So far, the signs are promising. The new kidney began producing urine shortly after the surgery last weekend, and the patient's condition continues to improve, according to physicians at Mass General Hospital. He is already walking the halls of the hospital and may be discharged soon. Over 550,000 Americans have kidney failure and require dialysis. Now think about that. That's over 500,000.
Mm-hmm.
There are centers, dialysis centers, all around the country, and people go sit there. Some of them are there between 2 to 8 hours,
right.
just sitting there with their blood being cleaned, and they have to go back 3-4 times a week. Now, how much does that cost?
Exactly.
And all those centers. So I bet you there's some people who are going to be against this kidney thing with pigs. Anyways, over 100,000 are on a waiting list to receive a transplanted kidney from a living or dead human donor. Just 25,000 kidney transplants are performed each year. So 550,000 are suffering. They get 25,000 of them get a new kidney each year.
Yep.
The human immune system rejects foreign tissue, causing life-threatening complications, and experts note that long-term rejection can occur even when donors are well matched. So, even years after a transplant, the body can reject a donated kidney. In recent years, scientific advances, including gene editing and cloning, have edged xenotransplants closer to reality. Xenotransplant meaning transplant from a different species into humans, making it possible to modify animal genes to make the organs more compatible and less likely to be rejected by the immune system. The kidney came from a pig engineered by the biotech company eGenesis, which removed 3 genes involved in potential rejection of the organ. In addition, 7 human genes were inserted to enhance human compatibility. Pigs carry retroviruses that may infect humans, and the company also inactivated the pathogens.
Interesting.
That's pretty amazing.
Yeah, it is. It is.
So I guess they just raise these pigs, you know?
Yeah, that's what I was wondering when I read this article. Like, they raise it, I don't know, specifically for this, I'm guessing.
Yeah.
Yeah.
In September 2021, surgeons at NYU Langone Health in New York attached a kidney from a genetically modified pig to a brain-dead man and watched as it began to function and make urine. Shortly afterwards, scientists at University of Alabama at Birmingham announced they had performed a similar procedure with similar results. Surgeons at the University of Maryland have twice transplanted hearts from genetically modified pigs into patients with heart disease. While the organs functioned and the first did not appear to be rejected, both of the patients who had advanced disease died shortly afterward. Patients who agree to these cutting-edge experimental treatments are usually extremely ill and have few options available. Often they are too sick to qualify for the waiting list for a precious human organ or are not eligible for other reasons. So I guess you have to be extremely sick, but not too sick.
Right.
To qualify for it. You remember that movie John Q?
Yeah.
Great movie.
That was a great movie.
Denzel Washington and gosh, that was there was a lot of political stuff in that.
Yeah.
Because now that child was sick enough to get a heart, but not too sick to reject the heart.
Yeah.
So he was the perfect candidate.
Yeah.
Yet they wouldn't give him a heart because he didn't have enough money.
Right. And it's an unfortunate thing in our system.
Yeah.
As health is kind of more of it's a privilege and it should be a right.
I agree. So. I agree. I mean, I'm a capitalist at heart, but not when it comes to healthcare. I feel like I have some socialistic tendencies, not as, but only with some types of healthcare. I think we just got to take care of each other. We got to do a good job of taking care of each other. But also, if money wasn't such a big motivator for some of these companies, then wellness would be promoted more.
Absolutely.
Because what we do in our offices is prevent disease.
Right.
But what a lot of healthcare facilities do is they hope that you get sick so you can be dependent on them for a long time, like dialysis for kidneys.
It's unfortunate.
Let's do the next one. New York Times. God, this is a big one, and we this hits home because this is something we talk about regularly, just offline, and you're gonna hear some of that conversation live today. The title is "Measles Cases Are Rising. Here's what to know about symptoms," and so why is this a big deal? Is first question. Like, how many people are dying from measles? What percentage of the people who get measles in America die?
Right.
I think it's 0.
Yeah. I don't know what the stat is, but it's 0 or near 0.
So why do we make such a big deal about it? I have my theories. Yeah. But again, it's money.
Yeah.
Right?
Yeah.
So, anyways, it says on Monday, the Centers for Disease Control and Prevention, the CDC, released a health advisory urging people over the age of 6 months. So they told all the 6-month-olds, as if they're watching the news, over the age of 6 months who are traveling internationally to get vaccinated against the highly infectious virus. The agency also said that anyone returning to the United States from abroad should watch out for measles symptoms for 3 weeks after they arrive home. And it says someone with measles can transmit the infection for up to 4 days before developing a telltale rash, according to the CDC. Measles spreads when someone who is sick coughs or sneezes, said Dr. Paul Offit. Boy, that's a famous name right there.
I've heard that name.
A vaccine. He's a vaccine expert at the Children's Hospital of Philadelphia. The virus can linger in the air for up to 2 hours after an infected person leaves the room. People can also contract measles by touching a surface that a sick person has contaminated and then touching their eyes, nose, or mouth. It's the most contagious of the vaccine preventable diseases, said Dr. Paul Offit. So let's talk about a little bit of the symptoms. It typically takes 1 to 2 weeks for someone to feel ill after coming into contact with the virus. The earliest symptoms tend to be a cough, runny nose, pink eye, and a fever. Some people may have a fever that goes above 104 degrees, which can be particularly dangerous for young children. Fewer than 1 in every 10 people with measles will also develop diarrhea, according to the agency. So they're going to get a fever, pink eye, runny nose, cough, and some of them get diarrhea.
This reminds me of chicken pox. When I was younger, we just got chicken pox. And
Exactly.
there was no immunization for that.
Nobody got upset.
No one got upset. It was like, hey, we had chicken pox parties.
And so we'll share some stats on that. Well, you brought it up, so let me share that right now. So we looked into this, and we watch Highwire, which is a great service and great podcast information there. Certainly, I'd promote them and would like you guys to watch it as well.
Yeah.
And some of the things they say we can't say here, but
Right.
they looked at data from 1900 to 1960. And the reason they stopped at 1960 is because 1900, death rate from measles was at its highest. Then it dropped to zero, very close to zero, like less than 0.001% of people got measles were dying in 1960. Now, immunization for measles began in 1963. Death rate had already gone down to zero prior to us immunizing against. Until then, people would get it and become immune to it naturally.
Right.
And so you go, okay, when it was high, how was it? And it was basically 13 people out of 100,000 who got measles, 13 of them would die.
Right.
So the odds of getting measles wasn't like 100% of people got it,
Right.
but of the people who got it, out of 100,000 of them, only 13 would die. So that's still pretty low.
Yes.
That's
yeah. Absolutely.
that's 0.013%.
Yeah.
Back and then it went down to 0.000000001
Right.
maybe in 1960. So just so you know, don't be afraid. I don't like these fear tactics. I
Me
don't
either.
like fear mongering.
Me either.
They call it fear porn. People read these articles, go, oh my gosh, measles on the rise. Is it really on the rise?
No, I mean, it is. If you look at the stats, week to week, but comparing it to year,
Yeah, it's actually not.
isn't.
So again, we looked at those as well. So when this article came out, they were saying there was 58 cases of measles, 58 new cases of measles across 17 states. So out of 17 states, the other states, nothing.
Right.
In these 17 states, there were 58 of them, and in February there was 14 new cases, which was the biggest peak in that. And so you go, well, that's a lot, because last year, in 2023, in the entire year there was 58. In the first 3 months of this year, they had 58. So you're like, okay, that's a big jump, right?
Yeah.
But then you go back to 2014, and it's like it's less than 10% of what it was
Right.
back then. So when you compare it to 10 years ago, it's very low.
Yeah. Yeah.
Now, 2014 was when there was the Disneyland measles outbreak, right? And they were saying, oh, a lot of kids are getting sick. When they look at the data, more than half of the people who had measles were adults. Grown-ups in their 40s.
Really interesting.
Yeah.
Yeah.
So anyways, we're going to stop with the data on that. But you're more than welcome to go check it out. There's more information online for you.
And the thing is, we have to also remember and appreciate, that we have an immune system, right? So, and the reason why the death rate is relatively low with measles is because we have an immune system,
Right.
And I know the past few years, we kind of forget that we have one.
Well, that's right, because of COVID.
Because
Everyone's been afraid. Again, it's fear porn, fear mongering,
Yeah.
and we've been terrified of that. But who survives those things is the people who have the stronger immune system.
Right. Yeah.
And how do you improve your immune system? We've talked about this. Sleep. I think it's number one. Make sure you're getting proper sleep, and then nutrition and exercise, and control your thoughts. Those four things.
Yeah.
Super easy. Yeah. But now, what kills your immune system? Fear.
Exactly. Exactly. In a sympathetic state, there's no way you're gonna, heal.
Exactly.
The immune system's gonna be dampened when you're in a sympathetic state.
Right. Sympathetic means fight or flight.
Yeah.
So when you're anxious, nervous, worried, afraid, your body cannot be strong. It gets weak because your body wants to divert all attention to its muscles so you can run away or fight. And that's not good. The article says most cases of measles are mild, but the virus can lead to severe complications, especially in infants, very young children, and people with compromised immune systems. Pregnant women contract measles, can give birth prematurely, or have a baby with a low birth weight. 1 in about every 10 children with measles will develop an ear infection. Measles can also lead to pneumonia, which is the most common cause of death from measles in young children, and it can cause blindness. Children can also develop brain swelling that can lead to deafness or intellectual disabilities. Gosh, that brain swelling thing. Okay, I'm going to go back to the data. 31%, almost a third of the cases back in the pandemic, not pandemic, but when there was the measles outbreak, 31% of cases were actually the strain from immunization that caused the measles. Not the measles virus.
Right.
So that's called failed intent or failed immunization. So that's big. That's a third of them. And also, I know for a fact that one of the side effects of that process is brain swelling. So not only does the disease cause brain swelling, the prevention of the disease causes brain swelling in children. Something to watch.
And can lead to intellectual disabilities.
Exactly. Now, Dr. Offit said vaccination is the best way to protect against the disease. That's if you're afraid of the disease. I'm not telling you what to do. I'm not allowed to. I am not a medical doctor. Neither is Dr. Michael. We're chiropractors, and we don't deal with that stuff. We just know that the human body needs to be cared for in a proper environment. And when you do, the results are good. So reduce your risk factors. You want to prevent measles? It's the same thing as preventing sudden cardiac arrest. It's the same thing as preventing myocardial infarct.
Yes.
And it's the same thing as preventing cancer and diabetes, all of that stuff. It's the same thing. Is make sure you're doing correct, proper exercise on a regular basis. You're watching your nutrition properly, and you're getting enough sleep, and you're protecting your thought process, because thoughts can lead to that sympathetic response you were talking about.
Absolutely. Yeah. And it's not, it's simple, but it's not talked about a lot,
Exactly. And it should be. It should be. But there's no money in it. There's no money in prevention.
There's
There's plenty of money in early detection, because if they early detect cancer, there's a lot of money in that. They early detect diabetes, there's money in that. That's why there's a new disease called prediabetes. That was never a disease before.
Right. No.
But it's an excuse to get more people under care. And there's a disease called prehypertension.
Yeah.
There's prehypertension.
Yeah.
And cholesterol numbers keep going down and down and down. Anyways, so we got 3 other articles, but we only have time for maybe one more. So what do you think we should do? There's one about twins. They did a twin study about mental health and whether, because these are identical twins with the same genes, why is their mental health different? Then there's a story about a doctor who received a triple transplant. This is just a neat story. It won't take too long. Then the last one we have here is about AI, how artificial intelligence is being used by doctors. What do you think our audience would be most interested in? You picked the last article.
I picked the last one. We do the doctor cancer.
Transplant?
Yeah, cancer
Good.
transplant.
Yeah, so we talked about kidney. We're going to talk about lungs and liver also. So the title, this is from ABC News. Doctor with cancer gets unprecedented liver double lung transplant from Northwestern Medicine. This was in Chicago. It's a medical story that's off the charts. Northwestern surgeons have successfully performed a combined lung liver transplant on a patient who had advanced lung cancer. And the patient is a doctor himself. He's a pulmonologist. How ironic is that?
Right?
Pulmonologist is a lung doctor. So he's a lung doctor, and he needed double lung transplant plus a liver transplant. His name is Dr. Gary Gibbon. Listens to other people's lungs, not usually his own. The Santa Monica, California physician was diagnosed with stage 3 lung cancer after undergoing chemoradiation immunotherapy at the University of California, Los Angeles. Gibbon learned the treatments had led to irreparable damage, not only to both his lungs, but to his liver as well. Now, did you catch that? Saying the chemotherapy caused irreparable damage to these organs.
I had to read it twice.
Yeah.
I was reading it last night.
We had told our audience, there was an article that talked about how do you know chemotherapy is going to be useful or not. There's a test that tells you whether chemotherapy is going to harm you or be good for you. So Brandy had read that article and did some research on it, so we're saving that. We were going to do it on this podcast. We're pushing it to the next one. When Brandy's back, she's going to talk about it. So hold on to that one. But that would have been good for this guy.
Yeah.
Because if they had done that test. Now, the article apparently said they don't do the test. They don't like doing the test, and they don't do it. Even though it's very cheap and easy to do, they don't do the test. They just put everybody into chemotherapy and radiation.
Interesting.
Anyways,
Interesting.
I was told, this is in quotes by Dr. Gibbon, I was told that sadly and terribly, there were no other options for me, and I should be considering palliative care or hospice care. Then his wife remembered hearing on the news about the double lung replacement program at Northwestern Medicine, known as the DREAM program. We got him on a plane, a medical flight here, a 4-hour flight from California to Chicago, said Dr. Satish Nadig, director of the Northwestern Medicine Transplant Center. Within 12 days of being on the transplant list, 2 lungs and a liver became available from one donor. So that's nice. It was all from the same donor. On a scale of 1 to 10, this was off the chart, never been done before, Nadik said. It was a first for a patient with active cancer, as anticipated surgery to remove all the cancerous cells from the chest cavity and his airways, and to replace the diseased lungs went well into the night. So first they have to remove the lungs.
Right.
Then they have to clean out all the cancer from everything in the chest cavity. Then they put the brand new lungs in there. He said, so the question was, how do we keep the liver alive while we complete the double lung transplant part of the procedure, said Dr. Antique Bharat with Northwestern Medicine Canning Thoracic Institute. The team used a perfusion machine which pumped body temperature blood into the liver to keep it alive for 17 hours, long enough for surgeons to complete the triple transplant. 6 months after the landmark liver and lung procedure, Gibbon is cancer-free. He's celebrating his 69th birthday and being a newlywed. Wow, very cool.
Wow.
What happened to his other wife?
Yeah.
Didn't his wife get him?
Yeah.
killed?
Yeah.
Maybe. All right.
Maybe this new wife. I don't know. Maybe that's.
Wow.
I don't know.
All right, good for you.
Yeah.
The remarkable medical achievements were only made possible thanks to organ donor awareness. I'd like to express gratitude for my donor and the family for the gift of life, Gibbon said. So happy ending, happy story, incredible technology of being able to do this. To replace lungs alone is amazing. To keep that donated liver alive for 17 hours,
amazing.
putting that into the body. And then you go, okay, but why, like, this guy literally is too sick. We just said, with the other article, you can't be too sick because they won't give you a new organ if you're too sick, but you have to be sick enough.
Right.
This guy sounded like he was too sick.
Yeah.
But I guess because it's such an experimental procedure, rarely done, they agreed to it. And praise God. I mean, the lungs and liver are functioning, working. But had it not worked, you just took those lungs and liver from someone else who may have had a better chance of living. I'm not making a judgment here. I'm just saying when there's publicity involved and it's going to make some news and bring some donation money to an organization, then we're going to do whatever it takes. But
and he's cancer free now. What's missing is tell him how to stay cancer free.
Exactly.
That's always missing.
Exactly.
And that, if we could possibly going to talk about the gene thing, but maybe on another podcast.
Right.
But lifestyle. Let's talk about lifestyle. So he had that, which is awesome. But now, when you start thinking about changing his lifestyle, he's 69. He could live to be 120.
Exactly. God willing, he will. And I hope he does.
Yeah.
I'd love to see him live at least 30, 40 more years.
Yeah, but we want to make sure that the cancer doesn't come back, and that needs to be addressed. And that's
right.
Never.
And I don't think anybody, a good friend of mine had open heart surgery, and he's a chiropractor, and they paired him up with a holistic cardiologist.
Okay.
Who is supposedly like all about not overusing medication and things like that. And I think my friend knew more about preventing future heart disease than this guy did.
Yeah.
Because they're just not trained in it.
Not trained in it.
Now, my friend, the reason he had to have open heart surgery is because when he was a child, he had Hodgkin's lymphoma, and they did a lot of radiation. And the radiation shrunk the valves and the arteries around his heart. So he didn't know. So he's very healthy. He exercises. He always did. He always has. He's a chiropractor. I mean, chiropractors just, I think, naturally just take better care of themselves, but because they want to set the example and so on. So he's always been healthy. So it was really strange that he needed the open heart surgery. But it was funny to see that this holistic cardiologist didn't know as much about preventing future disease. And I don't think cancer doctors or oncologists know much about preventing cancer either. I like Dean Ornish's work. He's done some good work about prevention. Definitely read his books. He talked about reversing prostate cancer and heart disease naturally. Great stuff. Dean Ornish is your guy. Dr. Michael, great job. Thank you for sitting in for Brandy.
Thank you. I'm not as pretty, but
neither am I. We apologize to our audience, but thank you for tuning. We appreciate you greatly. Hey, listen, if you want to see more of Dr. Michael, comment. Let us know, and we'll try to twist his arm and get him back on the show more often.
Yeah, it's fun.
Thank you. Good show.
Thank you.